Now, before I go into the bodily sensations that you might be experiencing at this stage of your pregnancy, I want to set up the why. Why are all these wild things happening to your body right now? The first reason is because of the increase in blood volume in your body. Your body takes on about 50% extra blood in order to nourish your baby through the pregnancy. So this extra blood creates a lot of extra swelling and a lot of extra padding in a lot of different areas in your body, which we'll go into. The second reason is the growth of your baby. As your baby grows, your uterus stretches and everything that exists in the middle of your body moves out of the way to make room for your baby. And as a result, things get a little funky and pushed out of their normal place. And then lastly, the hormones of pregnancy are definitely making things very different. One of those hormones is relaxin, and relaxin helps to make ligaments in your body more pliable or more flexible, especially in your pelvis, which is why things like backache, things like wobbly movements, not really having great balance, a lot of that has to do with that relaxin coupled with the growth of your baby. Another hormone would be estradiol and progesterone. Those hormones also have a major effect on what's going on in your body. So, keeping those factors in mind, let's dive into the actual sensations themselves. You might be experiencing backaches. That backache is as a result of your growing baby creating a lot more forward pressure or anterior pressure in your body. And then that pressure is pulling your pelvis forward, pulling on your sacrum and all the ligaments that connect into your sacrum, which can really put a lot of pressure and create a lot of discomfort in your low back. And it really can be something that's hard to resolve, but with every single sensation actually that I'm going to be talking about for the next few minutes, there is a strategy guide to help you dive into some major self-care to help support a lot of these different things that are going on in your body. But back to backaches. It can be a hard thing to actually do that much about because so much of it is as a result of what's happening with your pregnancy and the growth of your baby. But maybe it's helpful to know that it can get better after having your baby because your body will not have that extra weight and pressure pulling your whole body forward, and your pelvis and especially your sacrum will get a break. Another thing that you might be experiencing is sciatica, that again is as a result of the pregnancy. The sciatic nerve runs from the back of your pelvis down through your legs, and that nerve gets compressed by the extra blood and swelling as a result of that extra blood. That compression of that sciatic nerve can create this intense feeling of discomfort on one side of your body or on both sides. You also could be experiencing something called pubis symphysis dysfunction, which means that the pubic symphysis, which is right here, it's where these two ischial bones come together. There's a piece of cartilage here that because of relaxin, that hormone that I talked about that makes all of the ligaments, which are the connection points between your bones and your body, more flexible, especially in your pelvis. As a result of that, this area doesn't really work as well as it did prior to you getting pregnant. And so it can be easily stressed and activated. And so you might feel a lot of pain and maybe just some very distracting discomfort in that area as your baby continues to grow and your uterus continues to stretch. Another thing that I'm sure many of you are experiencing is heartburn and indigestion. And the reason for that is twofold. One, your baby, and two, the hormones. To unpack that a little further, I got to bring in my model. This is a model of a pre-pregnant body. And it still tracks because what I want to show you is this very close relationship of all of the parts in your abdominal and pelvic area. So this is your uterus. This is your stomach, or at least part of it. And below that is your bladder. So what I want you to keep in mind is your uterus, by the time you are ready to go into labor, is the size of a watermelon, the actual muscle itself. Right now, pre-pregnancy, it's about the size of a pear. As your uterus expands, it pushes up on your stomach, making it not able to hold a lot of food at any one time, which is one of the reasons why you probably find yourself grazing and eating lots of small meals. Secondly, the actual hormones of pregnancy that I described a little earlier make the sphincter that keeps your stomach closed and keeps your stomach acid inside of your stomach not work as well. As your uterus stretches and your baby grows and your stomach gets pushed higher and higher and higher up in your body without a high functioning sphincter, that stomach acid is going to find its way up into your throat much more easily than it has in any other time of your life. So you're probably finding that that's taking place after you have a tiny little bit of food. Again, not a lot of space for food in your stomach. And secondly, maybe when you lie down flat and that sphincter, which I explained is not working very well as a result of the hormones, the stomach acid flows up really easily. So it felt important to have what I like to call an anatomy geography moment in order for you to understand why heartburn is happening, which is why changing your diet might not necessarily nip it in the bud. What can be helpful, though, are things like antacids, Tums, even something like Prilosec if you absolutely need it in order to manage the discomfort of heartburn or indigestion. Incontinence or having trouble holding your pee is something else that could be up right now. As I showed you in the model just a moment ago, the bladder is very close to the uterus. So as your uterus expands and your baby grows, not a lot of room for the bladder to hold a lot of pee. In fact, you might find that you feel the pitter-patter of little feet of your baby on your bladder sometimes at this stage of pregnancy. So incontinence is caused by stress, the actual stress of the size of your baby and the stretching of your uterus, but the stress also is hormonal. Those hormones also make your urethra, which is the tube that your pee leaves through, not work as tightly as it usually does. That combination of hormonal impact and the actual physical stress of your anatomy changing is what equals to having incontinence issues. That typically gets better after you have your baby within a few weeks as those hormones really start to trail off and leave your body. But it's something that we definitely see a lot of and expect at this stage of pregnancy. Nausea can happen as a result of pretty much the same reasons that heartburn and indigestion are happening. Your baby's taking up a lot of space, and the hormones of pregnancy cause the sphincter of the lower part of the stomach to not work as well. So again, nausea, even if it's something that you had overcome after the very early part of your pregnancy, you might see it showing up again towards the end because of that last big growth spurt of your baby and the stretching of your uterus. Less talked about, but very much commonly experienced, are hemorrhoids. You could have hemorrhoids that are both internal, so inside the actual rectum, or external, meaning outside, visible to your eye. Now, hemorrhoids are happening because of the increase in blood volume and then the increase of pressure of your baby on the lower part of your rectum, filling up those veins and kind of popping them out, forcing them out of their usual placement. Hemorrhoids, again, like many of the other things I've talked about, will get better after you have your baby. And if the hemorrhoids don't get better, there are things that you can do to remove the hemorrhoids or to manage them. And those options are available to you in the guide that goes along with the module for this class. You might be having varicose veins on your legs, but you also might be having them on your vulva. So on your labia, whether that's the major or the minor labia, or in any area around that vulva area. And the reason for that, again, is that increase in blood flow. It's going to increase the size of your venous structure in many different parts of your body, including down there. Stretch marks are kind of the same thing. As those blood vessels are widening to accommodate that extra blood that you've taken on, your skin reaches its capacity of elasticity, and its response to that expansion of those blood vessels are stretch marks. The last two things I'll bring up are carpal tunnel and swelling, because they're actually one and the same. The swelling that you're feeling throughout your entire body is again due to this increase in blood volume, but that swelling is also a response to an increase in fluid that can take place towards the end of pregnancy as well. Carpal tunnel is a feature of that swelling because the actual carpal tunnel nerve can be compressed in your hands due to the increase in blood volume that's going on in your body. And that compression of that carpal tunnel nerve is what creates that discomfort in the hands. So you might not really be using your phone or computer or doing any repetitive movement that would equal to carpal tunnel in order to have carpal tunnel in your pregnancy. It might happen purely because of that increase in blood volume and increase in fluid in the body compressing that nerve in that carpal area. I just gave you so many things that are not feeling great in your body. But here's the thing. All of the things that I've talked about, as wild and intense as some of them may seem, they're actually really common. So deep breath. Hopefully that makes you feel a little bit better, even if there's nothing we can do for some of the things that you're going through right now. That said, there are a couple of things that can help. There's a lot of detail provided about those things in the guide that goes along with the module for this class. But I do want to take a moment and highlight some of the few things that you can do to make that exhaustive list of bodily sensations that I just went through maybe not feel so overwhelming. And the first thing is nourishment. With all of the things going on in your digestive system, it's going to be really important to do a couple of things. Eat small meals. There's not a lot of space anyway, and it's going to make you feel a lot better to just graze through the day. Also, eat bland foods, foods that don't have high acid, foods that don't have high spice. I know that's not very exciting, but it is going to help your heartburn and indigestion be a lot better, especially if you couple that with something like Prilosec or Tums or other natural remedies that could be recommended by a care provider like a naturopath or a nutritionist. Other nourishment steps that you can take would be drinking water to thirst, obviously not wanting to overhydrate because of how limited the space is in your bladder. Iron-rich and fiber-rich foods along with omegas can help support your digestive system, especially if you have hemorrhoids and hemorrhoids are making pooping super uncomfortable. Softer poops are going to make that process feel easier for you. So really keeping up with foods that are going to move really gently and easily through your system are going to be really important. Keeping up with regular movement and exercise is going to be a very helpful thing to offset a lot of these bodily sensations. Walking is one of my favorites. It's really easy. Anywhere from 15 to 30 minutes a day is going to make a really big difference. Also, if you're experiencing a lot of swelling, movement that could be helpful is actually just getting your legs up in a position where they're able to drain downwards and allow gravity to take a lot of that swelling out of your legs. You can also use your birth ball. Doing movements on that can be really helpful. Visceral manipulation or body work can also be a really helpful tool to make you feel more comfortable in your body. I really suggest things like acupressure, rolfing, craniosacral work, and just general massage to help release fluids, to help deal with aches and pains like sciatica. These are all absolutely safe things that you can do during your pregnancy to your level of comfort and to your level of access. And then lastly, something else to bring up is compression clothing, especially for things like swelling, carpal tunnel, even backaches and just general aches and pains. Compression clothing that can come in the form of shorts, hosiery, tops. You can even have compression clothing for your hands. Compression clothing can help you feel more organized and help to kind of constrict the blood vessels to help support a lot of the swelling and feeling of kind of overflow that's happening in your body. So wearing compression clothing for a couple hours during the day can help offset a number of different bodily sensations that I mentioned a little earlier. Another thing that can pair really nicely with compression clothing is gua sha, which is an old Asiatic practice of using a tool to firmly stroke the body to release fluid and to release swelling. You can use gua sha all over your body, and it's a safe and calming way to combat swelling in the body. And if gua sha doesn't resonate, dry brushing is another way to do a very similar thing, taking a dry body brush all through the body, ideally in the mornings or before you go to bed, starting low down in the body, moving towards the heart. Same thing if you take the brush over your arms. And then lastly, a good old bath. I love baths myself, and I highly recommend them during pregnancy. Baths are not going to do anything negative to your baby. They are safe as long as you keep them at a good temperature.